From my many years working as a clinical social worker and addiction specialist, I can tell you that substance use disorder impacts every member of the family. It can wreak havoc, causing feelings of shame, mistrust, anger, neglect, sadness, trauma, and even PTSD. When left unchecked, addiction and several other related behaviors can become entrenched in a family over multiple generations. Finding support that meets your family's needs is a critical step to starting the recovery process for all members of the family. In this lesson, I'll help you navigate your options for family and individual therapy, support groups, and other self-help resources. We'll also review how to evaluate programs according to your family's unique needs. For individual or family therapy, there are many options, which include psychotherapy, also known as talk therapy, with an addiction specialist. This can be done on an individual basis, as couples therapy, or as family therapy, including siblings or other close family members. Some of the models that specifically address addiction include the invitation to change, which is covered later in this course, CRAFT, or community reinforcement family training, contingency management, which is a behavioral treatment to incentivize people not to use drugs, and of course, there are interventions. Therapy isn't the only option. You might attend a professional or peer-led run psychoeducational support group. There you'll have a chance to interact with others. These groups are typically less personalized and less structured, but are helpful for building a sense of community and gaining real advice from others about what works and what doesn't. Support groups can be organized around specific situations or circumstances, such as the age range for the young person with an SUD, a specific substance they focus on, or a certain philosophy or approach they utilize. I suggest you consider the following when choosing a support group. Do you feel comfortable and can you relate to the others? Does the group address challenges that affect you and other members of your family? Does the group teach you new ways to think about communication within your family? Does the group support you? For example, if your child continues to abuse substances, but you allow him to remain in the home, are you able to make positive use of their suggestions, or is it challenging at this time? When you're ready to seek help, these are important questions to consider. Has your child been diagnosed with additional psychiatric conditions? For example, if your child is dealing with an anxiety disorder, a psychiatrist or psychologist could help you better understand your kid's behavior. What will your insurance provider cover, and what can you afford? If your insurance coverage doesn't provide affordable access to therapy, then a self-help support group can be a more affordable option. Are you feeling isolated and looking to connect with others facing similar challenges? If the answer is yes, then a self-help support group might be optimal for you. Remember, you don't have to stick to one form of therapy. You can always attend family therapy, individual therapy, and support groups throughout the recovery process. Another possible option for support is self-help. Self-help options include attending 12-step meetings such as Al-Anon, Nar-Anon, or Families Anonymous, which are long-established community support groups guided by the 12-step philosophy. These meetings are widely available and free of charge. You can talk to trusted friends, families, and advisors, a spiritual leader, or a mentor, or read credible self-help books. Self-help options are often extremely valuable, but they are not necessarily a substitute for professional help. Remember, even if only one person in your family has a substance use disorder, the whole family will need help in working together toward recovery. The goals of family treatment are to heal together, to repair relationships, and to foster sober, supportive behaviors. Now is the time to start looking for the therapist or group that can best support you and your family.